My name is Carmelo. I'm 23 years old. I have a 4-year-old son, and I'm addicted to butt injections.
My name is Dr. Anthony Yoon, and I'm known as America's Holistic Plastic Surgeon. On this video, we are going to react to an episode of My Strange Addiction, specifically one where a woman is addicted to illegal silicone buttock injections. Let's take a look.
My name is Carmelo. I'm 23 years old. I have a 4-year-old son, and I'm addicted to butt injections. Before the injections, I was a size 4, and now I'm in a size 10. I am happier because I never had a butt. It was nice and firm and up how I wanted it to be up. I picked up more attention than before as far as comment on my butt or something like that. It definitely steps up my confidence.
Buttock enhancement is the fastest growing cosmetic procedure today. Whether it's J-Lo or Beyonce or Nicki Minaj, it's all about the rear end. Carmelo, beautiful young woman from Detroit. I actually live in Metro Detroit, so this is my area.
Over the last 3 years, Carmelo's had 54 butt injections, yet she's never bared her behind to a plastic surgeon. She receives her shots on the black market, getting pumped with an unregulated substance that's been known to include metal lubricant and cement.
Well, this has taken quite the turn. So buttock enhancement is a very popular procedure, but now we're going into black market craziness here. Cement, lubricant, these are not substances that you should have injected into your butt. And the number of times that she has had injected, over 50 times. When you inject substances into the body that are not made to be there, your body can react in very, very aggressive ways. The body can wall the area off and create a lump. If you're unlucky, you can develop an infection that can literally cause parts of your body to turn black. And if you're the unluckiest, you can die from it.
Carmelo plans on even more injections.
If I got 36 more shots, I think my butt would be the size I want, and it made me happy. Until I'm confident with my body on the inside and out, I can't say that I will not go back.
One of the signs of an addiction is doing something that is harmful to yourself, that you know is harmful, but you can't necessarily help yourself. So here she is saying that she had 50 plus injections into her buttocks, but she needs more. And as you can see by the video, she has a fantastic figure. I mean, she is a pretty young woman with a rockin' figure. And to feel like that's not enough, it's sad. It makes me sad.
Your shot lady, she just got indicted. She was lying to you, she was lying to everybody else. Aren't you pissed off? Aren't you mad that she was injecting you with industrial grade silicone?
I always heard about her, like, you know, messing other girls up and stuff like that. But to me, in my head, I'm like, no, I need this injection ASAP. I need to get just a little bit more bigger. I'm very uncomfortable with my body.
This is something I hear in plastic surgery all the time. I need to get bigger. I need a little bit more. We do a procedure and it helps somebody feel better about themselves. And so they get this rush of dopamine and they start feeling really good about themselves, which is great. But then they lose that as time goes on and they want that rush again. People get into this kind of cycle where they start overdoing things, a little bit more, a little bit more, a little bit more, layering these procedures on top of each other, and in the end you end up looking weird and strange. Actually, I did a video not that long ago where Courtney Cox mentioned in an interview where she had a little bit of filler and she liked it and then just had more layered on top. And it wasn't until she had multiple treatments that she noticed, wait a minute, this isn't right. I am doing too much. One of my big tenets in holistic plastic surgery is to do the least amount necessary to make you happy.
I think that the only thing Carmelo can do is just be bigger than her addiction. She has to realize the biggest thing in this situation, which is her son and which is her health.
That is such a great point, because when we're doing these procedures, we always have to look beyond just ourselves. The ramifications of you doing this procedure can ripple out to so many other people, especially if you have children. One of the big parts of holistic plastic surgery is making sure that we don't over-operate on people. I get patients who come in to tell me that they say, look, Dr. Yoon, I want a tummy tuck, I want a breast lift, and I want my arms lifted, and I want to do it all at one time. And I tell them, look, that's too much surgery. You could die from this operation. Think about your child. What is most important to you? What's more important for you? To be around, to take care of your child, and to enjoy your relationship with your child, or to have a slightly bigger butt? What's more important?
23-year-old Carmelo is addicted to black market butt injections, a dangerous cosmetic procedure. But a friend worries the shots could be hurting her health and has convinced Carmelo to see a doctor.
What brings you in today?
I got some butt injections a little while ago.
Okay.
And I wasn't quite sure what she was injecting me with.
Who's that idiot? So they asked me to be involved with this show many years ago, and a bit of a surprise there, huh? So this is me. It's one of my earlier TV appearances, and let's see what I say to her. Hopefully I give her some really good advice. Do you have any idea what she injected you with? Did she tell you?
She said liquid silicone.
Okay.
But I'm not sure if that's really what it was.
Did she do anything afterwards? I mean, did she stitch up the incisions?
She put super glue, then cotton balls on each shot that she gave me.
Now notice how this doctor has such good bedside manner. Also notice the lack of wrinkles in the face. No, I'm kidding. So she said that she had super glue or crazy glue used to close the incisions. Actually, we use something very similar sometimes in plastic surgery and the emergency rooms called Dermabond. I wouldn't recommend using regular super glue at home because it is not sterile, okay, but we do use something medically that is very similar. So you've got some abnormalities on your x-ray. You can see here, this is your thigh, the fat in your thigh, which is smooth and normal, but up here it looks kind of spongy, this texture, and that's definitely not normal. So even though you're healthy, it just takes one bad injection to literally kill you. If it's a substance that's not sterile, you could get some major infections. It can enter your bloodstream and it can literally clot up your lung. And within minutes, you can die. And that's it, end of story. After being in private practice for 15 years, I realized that sometimes you just can't beat around the bush. Sometimes you just have to be very direct and honest and blunt if you really want to get through to somebody. In Carmelo's case, here's somebody who has talked to friends and family, and they've tried to convince her, don't do this, it's dangerous for you, you could die. For me to start talking about things like infection and lumpiness and hardening and disfigurement, I mean, those are true. And for the majority of people, you mentioned that, and they're scared in and of itself from those, and they're not going to do this. It brings to mind, I do a lot of breast surgery, and one of the risks in smokers is that your nipples can turn black and can actually die if you smoke and have a breast lift or a breast reduction. It's true. I tell them, look, if you have a breast lift and you smoke, your nipples can turn black and die, and you'll have no nipples. And so with Carmelo here, it's basically, look, you do this, and you even do it one more time again, you could be dead. And the worst part of it is your child will not have a parent afterwards. The number one thing is you can't let yourself do this again.
I don't think I will be going back to get more injections. And I just hope that I just can learn one day, I guess, just to love my body and just love myself a little bit more than how I am now. I'm very worried that something could happen to me because I have a child to take care of. But I do believe in change, and I know I gotta take care of myself to raise him.
Yay! So we did it. I don't think it was just me. I do think it's important that her friends and her family were supportive and really tried to encourage her to go in the right direction. So I'm really happy that this is something that I was able to contribute to as being a part of a team to help Carmelo. Now, if you're in Carmelo's position and you want larger buttocks, what do? You don't have to undergo surgery to get a bigger butt. Obviously, there are exercises that you can do, and there's a new treatment called Emsculpt that basically stimulates the muscles of your buttocks to contract 20,000 times over a 30-minute period. And studies show that it can increase the thickness of muscle by about 15%, and it can reduce fat and lift the buttocks as well. So if you're looking for a slightly larger, reshaped and lifted buttock, then Emsculpt may be a good option for you. It is totally non-invasive and totally safe, and the results seem to last upwards of 6 months or longer. So you don't have to have illegal silicone buttock injections. Instead, look into things like Emsculpt. They just might be worth your while. Well, that was a lot of fun. One of the things I really enjoy watching on TV are some of the crazy things that we see on shows like Botched, and I've reacted to a number of them. Take a peek at this playlist I have here of Botched episodes that I've reacted to. I think you're going to really enjoy it, and it's going to shock you what some of these people have done.